on Health, sponsored by Lonerock Clinic.
Welcome back, folks. Well, as you just heard, it's our Eye on Health segment. I'm joined this morning by Kimberly Metheny with Lonerock Clinic, where we are talking about a very important topic. I mean, frankly, any time of year, but especially this time of year, May being Mental Health Awareness Month. And I feel like for a lot of folks, it's very different than it was 5 years ago, 10 years ago, the outlook on getting help that you might need. But we're still in a position where there are some folks that might not think it's socially acceptable to reach out for that extra help. So tell me about that. Where do things stand? What do you recommend to people?
Absolutely. So I think definitely perspectives are changing on mental health, and a lot of people are affected by it. About 1 in 5 adults do have a mental illness, with about 5.6% having a severe mental illness. So treatment options have definitely changed. Our outlook has changed. There are more treatment options available. And so I think the next shift in perspective around mental health is identifying getting treatment as a strength and not a weakness.
Well, and there's such a wide range, the gamut of what qualifies as someone that might need mental support, mental health support. And I think for a lot of people, that was always one of the issues, is thinking, well, I'm not dealing with something I've seen in the movies or something like that, but still needing that extra help.
Absolutely, yep. It's a wide variety, whether you've got intrusive thoughts, maybe things scare you a little bit more than they should, or maybe you'd like to be more social or get out and about. Maybe you have some habits or some things that you can't get done around the house. Come in and talk to someone. A neutral perspective is just an amazing thing to have in your pocket, even if you don't have a mental illness. Just getting help, having an outlet to talk about these things with someone who's confidential and out of your circle.
Well, and so what do you recommend? What's the best way to go about that? Because that, I'm sure, seems a little daunting to folks that might not even know, where do I start?
That's true, absolutely. So here in Eugene, we're actually really fortunate to have a lot of various different places to go and seek treatment, whether it be an outpatient area, just going in and seeing a therapist, bringing nothing with you, or bringing everything with you, all of your baggage, so to speak, and getting an assessment to get the help that you need, matching with a therapist that you like. A lot of people actually don't realize that you can find a therapist that matches with you. If your therapist isn't working for you, let's get you another one.
Well, that right there, very interesting point. I would think for a lot of people that might be a hurdle that, especially if you're dealing with some sort of a social anxiety, saying, no, I don't care for this particular individual. How do you have that sort of a conversation?
Well, it's definitely a skill, but as a therapist, I can definitely say that we never take it personally, and we're definitely here. We want people to feel comfortable talking to us, and if per se maybe I'm not your cup of tea, I'm a little bit chipper sometimes, and I've got a big smile on, but sometimes we do need to tone it back and mirror what our client is giving us. But I think it's important to find someone that you mesh with, somebody that you match with. And also, here in Eugene, we do have a lot of options for treatment, and we got plenty of therapists. I can definitely say that.
That is good to know and good to have here in the month of May. Again, Mental Health Awareness Month. Thank you so much, Kimberly.
Of course.
It's a difficult topic for a lot of folks to get into, but I think we got some good tips right there.
Yeah,
appreciate it.